We're getting an inside look at one of the most advanced pieces of technology here at Oroville Hospital, the Da Vinci. It performs robotic surgeries, and we're going to check in with General Surgeon Dr. Nagubandi to see how it works and how it's benefiting patients here. All right, Dr. Nagubandi, we're obviously talking about a fascinating piece of equipment that we have here at Oroville Hospital, the Da Vinci. First, tell me what does make it so important to have it here at the Oroville Hospital?
The Da Vinci technology has been there for more than a decade. When we looked at the opportunity that there's no advanced system, which is the Da Vinci Si or the Si system, available north of Sacramento in the Northern California. So we saw the opportunity and we brainstormed on that, and our administration went ahead and took the decision to bring this to benefit our community here and the surrounding communities so that they don't have to travel down to Sacramento or to the Bay Area.
Show me the difference, or tell me the difference between maybe what other hospitals are using and the Da Vinci, the robotics of it. What makes it better?
The differences between traditional laparoscopic surgery versus the robotic laparoscopic surgery. In traditional laparoscopic surgery, the surgeon is operating with his hands, and there's an assistant holding the camera and maybe an extra instrument. Whereas on the robotic system, I can move the camera, zoom it where I want, and leave it there, and it does not move until I want it to move. Similarly, the additional arm or the additional instrument through the third arm, as I call it, can be operated by me, and the tissue or the structures could be retracted the way I want, and I could leave the arm there and toggle it back to a different arm and operate with my hands.
Wow.
That's one of the benefits of this technology. There are other benefits such as visualization. There is a three-dimensional visualization compared to the two-dimensional visualization in the traditional laparoscopic surgery. In the surgeon console, we actually get a 3D image of the structures, so that actually helps us to differentiate the structures better. In the traditional laparoscopic technique, you have the instruments that open like a jaw. So the degrees of movement are limited, whereas in the Da Vinci technique or technology, the instrument has a mini wrist, which actually helps the surgeon to increases the dexterity and the ability to work in a more hostile environment inside the body cavities.
And just watching you use the machine was amazing. I mean, what kind of training did you have to go through before you mastered it?
First of all, even for those who have not done a fellowship but have been doing quite a bit of laparoscopic surgery, learning the Da Vinci technique will be relatively easy rather than someone who has never done laparoscopic surgery. Even for those who are laparoscopic trained or who have been doing a lot of laparoscopic surgery before, we go through an extensive amount of training, which includes learning how to master each skill on the Da Vinci machine. And we went to a what we call as a wet lab. We went to the Da Vinci headquarters and worked on an animal model, which is an anesthetized animal, and we performed various operations. So it's like having the operating room without the patient, but patient being the animal. After that, we came back to our hospital and did dry run before we actually performed it on a human. Dry run of how the machine should be set up, where everything should be, the vision card, the surgeon console, and the robot itself.
Great. So what does it mean for patients at Oroville Hospital, the fact that there is this state-of-the-art technology within our reach?
What it means is, number one, for those who are looking for getting the benefit of this new technology or the state-of-the-art technology, they don't have to travel far distances, the nearest being Sacramento. And we have highly trained and skilled surgeons here and we're able to offer that service here, and that's a big plus for them.
And what types of surgeries does it cover? You said, laparoscopies, but what does that mean for maybe a patient?
Similar to the traditional laparoscopic technique, the operations are done through small holes,
Okay.
less than 1 centimeter in size. Maybe one of those instruments, the incisions can be maybe 1.5 centimeters in size. This is called a multi-port technique, where multiple small incisions are made as required, and this procedure is done. So you're looking at smaller incisions. Not necessarily much different from the laparoscopic technique, the traditional laparoscopic technique. However, FDA has approved this system for single site operation. In other words, where we place a 2 centimeter incision in the belly button, and you can take out the gallbladder through one incision. So many times you can't even see the incision once it is healed, because incision is placed in the belly button. There is traditional laparoscopic surgery without the robot, where you can still do the same technique or same operation with the single site incision using different tools. However, the robotic technology makes it a lot easier.
So many benefits. And just as a doctor, what do you enjoy about the technology and using it?
As a surgeon who loves the minimally invasive technology, the visualization that I get on this machine through the surgeon console is very good, improved, and three-dimensional. And the ability to do that wrist kind of movement, which increases my dexterity, that's really exciting. This actually gives me more confidence and dexterity in order to do those fine movements with these specialized instruments.
That's great. Well, that's all I want to ask. Is there anything else that you'd like to add?
We're going to be offering the single-site technology or single-site surgeries also here, and we'll be glad to answer any questions the patients or the community or any of you have. And we always spend time with the patient before we actually schedule them for any of these surgeries. And I want everyone, and particularly the community and the patients, to know that the robot is not in control, the surgeon is in control.
That's a very good point. Thank you so much.
Thank you very much.